Hey, everybody. It's Bill Couzens, founder of Less Cancer. I'm here with Miles OBrien, who is joining us for this conversation about the upcoming National Cancer Prevention Workshop. We're super excited to have Miles with us today. So welcome, Miles.
It's a great pleasure to be with my oldest friend and a great crusader and warrior in the cause of preventing cancer.
Mm-hmm. Well, I appreciate that. That's a bit of an overstatement. We have
you're doing the great work, Bill. So take that on board, will you?
I will. I appreciate that. When we started this model of not having things that cause cancer cure cancer, that was a tough model to go up against. It was really tough. And I was just explaining to a legislator the other day who was talking about using funds from some alcohol or something to cure alcoholism. I was like, that model has never worked. It's never worked for tobacco. It's never worked. We still lose almost 500,000 people a year to cigarette smoking. So we know that selling cigarettes and taking that money to say, quit smoking is a non-worker because we have so many people dying under that current model across the board. And I think that, you were certainly one of the early ones that stood with us, that understood this notion, this idea from a non-scientist guy of what can we do to lower the risk? How can we tap down cancer? Are there ways that we can do it? Sure enough, there are, but we didn't know how to talk about it then. And so you were a great piece of bringing this to the forefront and expanding this landscape and this conversation, which has really been a game changer since, we first started working on this in 2003. Certainly has been a lot of years and a lot of hammering.
Yeah, and it really is David versus Goliath, Bill versus the infrastructure that's out there. As a reporter, what we do, if we're doing our jobs correctly, is we always follow the money, right? And the reason that the people are still dying of all those things is that somebody somewhere is making a lot of money off of their deaths. Right. That's the honest, mean, cruel truth of it all. Mm-hmm. So that's one thing. There's profit in all of this. There's profit in the chemicals that get put into our systems, into our environment, onto store shelves without being properly vetted to make sure they're safe for people, which is kind of crazy. And then the other side of it is too, Bill, which I discovered in enduring the loss of my mother and my sister, both to cancer, is that you realize what a business the Cancer Inc. is, right? There is a whole huge profit center to treat the disease. And so there's money being made getting us sick, and there's a lot of money being made treating us. Mm-hmm. But nowhere in that mix is there any natural moneyed constituency to talk about prevention. To the contrary, it goes up against those very profit centers. And I give you great credit. You're not the kind of person that's selling the Less Cancer logo to Kentucky Fried Chicken. And there's a lot of temptation because a lot of these big companies would like to greenwash themselves a little bit by having somebody like you partner with them and make it all seem okay. But you've held the line on that. And that's a tough thing to do. And that's why
it is
I give you so much credit for fighting that, because, you could have taken in a lot of change over the years, but you're selling your soul if you do it.
Well, and I think for us, as we get older, we know more people that have been in our shoes, that have had families dwindle down to nothing because of cancer, and not because of their genes, but because of where they lived or how they lived or what they ate, for lots of other reasons beyond their genes. And so what we thought was happenstance wasn't really happenstance. And that everything that we do in the work for Less Cancer is inconvenient. What do you mean I have to go find another source of water? Why isn't this food good? And I'm as ADD or more ADD, I guess, than anybody when it comes to grocery store shopping. When somebody says, buy this, grab this, do that. Now I have to go in and I have to read labels and know what those big words mean. And so I've now slimmed that down to, is it really just an apple, or is there anything else in this apple that I need to be aware of? Or, I'll share this story now. I know we should be talking about the workshop, but, I think it's pretty common knowledge from when I was writing, I'd had a nerve tumor removed from my spine that was quite debilitating. And as I wasn't moving because of pain, I was ballooning out into like supersized weight. And you remember we were in Boston walking. I said, Miles, I cannot walk that far. He goes, Bill, it's a block. You said, Bill, it's a block. And I said, honestly, I can't walk that far. So, you had a hard conversation with me. It's like, nobody's running less cancer than you. And you kind of scared me into devoting any extra money I have, time or resources into physically making changes in my life that were grueling and super hard because, I think 5 years ago or 4 years ago, I don't know how long ago, a few years back, I couldn't walk a block. I could not walk a block. And to think that I can ride 30 miles on a bicycle is crazy.
Yeah,
that was because of you and because you understood what it meant to fight. And obviously because of your accident and having your arm amputated, you're not the person to whine back to about, I can't move or I can't, you're not that person because you have heroically handled so many of these things. I mean, when
you give me trouble, I give you the hook, pal.
Yeah.
Fighting cancer is hard.
Yeah.
But anyway.
You've been,
it's really interesting because for both of us, this has been, a personal journey. Both of us, it begins with loss, mm-hmm. and trying to kind of comprehend why we have lost loved ones, and suddenly coming to this horrible realization that maybe, just maybe, it could have been prevented. We can't say for certain, right? There's problems with correlation and causation. But on top of that, what it has done for us, and I hope by extension, the less cancer community, it's made me think about the risk factors that I encounter in the course of a day. What am I putting in my body? How am I exercising or not? Can I walk a block? All those things are factors that lead people down the road to that horrible diagnosis of cancer. And so that's why this organization is so effective and so needed. It is completely authentic, and it arises out of personal loss, a personal struggle, and frankly, a triumph over some of those struggles. So people get that, they see it, and it makes them think about their own lives and what they can and should be doing.
I'm proud of the changes that all of you are a board member. So everybody in Facebook world and wherever else this plays knows that you are a board member. But I'm proud of the impact we've made on policy and some legislation and some best practices. And I'm proud of that because, the hard challenge to those tools and developing those tools is, unlike selling a Band-Aid or a chemo course or a treatment of some sort, prevention's healthcare tools are very different. It's education, which now, we're educating a global audience of physicians, nurses, and professional public health folks. It's legislation, it's policy. So the tools are really different, and people don't understand. They think policy is politics, but there is no divide when it comes to cancer. There is no divide. And we prove that every year with this workshop when we have more and more members of Congress and the Senate jump on board to learn more, to get better informed, and to be part of the solution and to share their perspectives, which are so important. I've never believed we could solve problems if we didn't have everybody at the table. So our practice, as it is with where we get our money from, is making sure we have lots of different people around the table, lots of different perspectives, political parties, everything, and we have been successful in doing that. I'm especially proud of the fact this will be our strongest year, and such a turbulent year. that we've managed to really work with people across all lines to get them together with this issue of cancer prevention, where it's about education and policy, not politics. And people confuse that all the time, or they diminish the importance of that. Lots of tools can be developed through public health policies. And so where people may say, I'll smoke wherever I want, or I'll do whatever I want, it isn't just about you. Our world is so small. We see what happens when a place like Flint, Michigan tries to save a few dollars. Ruins millions of lives for generations. We see what happens when we don't have policies in place that protect the community, especially those that can't protect themselves. And so this workshop is really critical in bringing a greater understanding on both sides of the aisle so people can do their jobs and better protect their communities. And you have been instrumental in developing that, you as moderator. I'm wondering if you care to share anything about this last panel that you moderated.
Yeah, you know, it was a reminder of how much of a toxic soup we're all living in, and more importantly, and it's really it's been so refreshing over this past week to see an administration trying to tackle environmental and climate issues. And the really important issue that's embedded in all that is the issue of environmental and socioeconomic justice. It is poor people who are disproportionately affected by these chemicals in the environment, whether it's the people of Flint, Michigan, whether it's the people of Louisiana who have to live next to the refinery, whether it's the people who can't afford to live anywhere but right along the Cross Bronx Expressway. These are people who don't have the means, don't have the voice, they don't have a seat at the table. And it's so important for all of us to collectively be honest about what we're doing. We're poisoning, and we're allowing the poisoning of a certain strata of our own society. Well, I mean, you know, could there be anything more corrosive to a healthy democracy? We talk about income disparities, but this is what the real disparities are about. It's about the justice of it all. You know, and here it was the odd coincidence, irony that as we were having our conversation about all these issues, there was an insurrection on the Capitol. You know, once again, underscoring the sense that people feel as if they're disenfranchised from the process, that they're not a part of it, that they're frustrated because they don't see government acting on their behalf. And it's so important that people like you, Bill, get up there and say, look, this is not an issue that has a natural lobby, but people are dying. People are adversely impacted who don't have the means to do anything about it. They can't pick up and move. You know, this doesn't happen inside gated communities. So it's tough, though. You know, I do. You know, there isn't a politician in the world who wouldn't stand up and say they're against cancer and they want to prevent cancer, right? It's the devil is in the details, right? It's when that desire meets with somebody who's offered up a lot of campaign donations, whether it's the fossil fuel industry, the liquor industry, the nicotine industry. You pick your poison. Right. They're all they've all spread plenty of money around Washington, and so it's the power of people rising up and saying when enough is enough. We're not going to allow ourselves to live in an environment like this. And I'm hopeful that you know, the Biden administration is off to a good start, making that a central to its environmental and climate policy, tackling the issue of the injustice of it all and the economic component to this. And so I think there's a great opportunity for you, Bill, to, you know, pick up a little bit of momentum, almost a boost, because the conversation changed overnight almost with the end of the previous administration and this. And I think we can move the ball here if we do it right.
I hope. But I think also when people understand some of these issues impact their health, impact their family, their children's health, it it expands it into a whole. It's not about the weather, it really is about quality of life and living. And then also too, a recent discussion I had with a physician. I've had all this surgery in my mouth recently, so if you see anything, that's why. But there's this issue of pain management and all these like laws and legislations and things that don't benefit the patient, but benefit the lawmaker, or they benefit the attorney that thought of the policy, or they benefit somebody else. And I have this thing where I frequently say, it's not healthcare unless care is involved. Like, it's not going to be healthcare unless you really care. So, the one recipe for one person is not the same for all. And we're finding, like, not only these inequities, which we have the John Dingell panel on disparities, but we're seeing this in healthcare and across the board. So as a society, we're making people unnecessarily sick, and then we're not really good at treating them. And that seems like a very negative double-edged sword, right?
Yeah, well, I mean, it goes back to that original point I made. We have a system that is built on treating diseases, not on prevention. The entire system writ large, even outside the issue of cancer, is built on that notion. Mm-hmm. And I don't see any way to change that fundamentally until we take the profit out of healthcare. It is just, there's no way to square that circle. And we've got, I know that's, that's a very controversial issue in this country. People think we have this great healthcare, but if you look at the outcomes and the cost involved, we have a terrible healthcare system. Yes, it's great if you're in the top 0.01% and you're the Arab, you're the Saudi sheikh who flies into Boston to Mass General to get treatment. Yeah, it's great there. For the rest of us, though, it's not a good system at all.
It's sticky. And I really, we've talked often about the beauty of addressing some of these issues and lowering risk for illness and death and financial ruin, because it all involves financial ruin at some level. But we've talked about tapping down this issue of suffering, human suffering. And I think it's interesting that your panel was recorded on January 6th, because what an example of human suffering that was everywhere. Just heartbreaking. And we see the same impacts on all these people that are devastated by these environmental exposures, by some of the toxins that are just flowing free through our environment. And when people don't really understand what we're doing, or they have a hard time grasping it, I often think of this notion of less suffering, this idea of less suffering. Because even if you are cured from cancer, which is still pretty rare, now they change the narrative to say you can live with cancer. You're still suffering. There is no win. People may have lost their home. Being physically alive, and by the way, they consider every person living with cancer treatment a survivor. Anybody alive a survivor doesn't sound like a win to me. So we can do so much. We know, we know stories of people that have reduced incidence of diabetes, or they've turned their lifestyle around with, that issue. I've turned mine away with a lot of weight loss, and your inspiration for me, I've turned a lot of that around. But we know that diabetes is a risk for some cancers. We know that, inactivity and poor diet are risks for poor cancers. So that's what we really have to get our heads around. And I understand not everybody has a choice. Not everybody has a choice. Many, many people in this country cannot protect or care for themselves. They just don't have those options. So I believe we have a voice to do that, and I think we do that. I think we are the lobby for the poor. And I'm very proud of that piece of what we do.
Well, you should be. I mean, this is a constituency that needs all the help with megaphones it can find. And, we have our political system is awash in influence money, and tackling that is no small challenge. And you're fighting the good fight. And, ultimately, I guess, I think I'm quoting Dr. Martin Luther King talking about the long arc of history bends toward justice. I love that quote. Mm-hmm. And you have to be patient, right? It just takes time, and you have to keep showing up and being present. And, you've been doing it now for, 18 years, right? Is that right? Jeez.
Yeah.
And
I might have had hair when I started.
Nothing could dissuade you. You just, the other quote I like a lot is Woody Allen, 90% of life is showing up. You kept showing up. And in spite of the fact that really you've been, you have a nice group of people that are helping you right now, who are helping you push the ball a little forward. But most of this time you've been alone, really alone. But the key is the message that you're putting out there to the public and to the political realm. It just resonates with people because everybody's touched by this. Everybody has experienced loss in some fashion. Listen, life is about loss, right? But people know something's up, and they want somebody to be honest about it, and to have that integrity and that honesty and that passion. I say in the long run that beats the money.
Mm-hmm. I hope, when we go to, or I go to medical schools, there have been some medical schools that I've spoken at. I ask these students to really advocate for their communities because they're the ones with all the education. They're the ones that have a voice. They're the nurses, the doctors, the physician's assistants. I'm a liberal arts major. I'm proud of it, but not a very good student. I'm not a scientist. And so we really need to uphold science in a very different way, much better than we have in recent times and even 20 years ago. We need to point to the experts and the scientists that really understand this. They may not be the communicator you are or even me, but they need to understand there are things that we can do as just people to make change, especially those people with the education backgrounds. And I know the University of Virginia has been so critical. Their continuing medical education team, our friend Andrea Zimmerman, their educational engineer, has been incredible. And of course, that whole department, Jan Balmer, who's our chairwoman, is incredible as well. And we have really, when I think that almost 4,000 people have registered either for a certificate or continuing medical education credits through our programming, it's amazing to me. And not just like from the neighborhood, 10 countries. And when our workshop streams live on Facebook last year, we had over 30,000 participants in over 40 countries. So we're doing our best to get the best programming out to people for free.
Well, first off, liberal arts represent, man. Liberal arts. It's not for loser. For liberal arts. So I listen, I'm not a scientist. I play one on TV. I'm a history major. I'm a complete fraud at what I do. But I wasn't taught science very well, and I got turned off on the whole subject. But now I know its value. And I learned its value from a very privileged position of being first the science correspondent at CNN and more recently in PBS. But, I get to learn science from Nobel laureates. How lucky am I? But what I've learned over time, a couple things. First of all, on the idea of journalists and what they do for a living. Journalists are notorious for just laying out a problem and not really offering up any solutions to the problem. It's kind of, they teach you early on in your career that's boring stuff. This is give them the problem, let somebody else sort it out. Well, I can't stand that. I can't stand that. The science is inherently about seeking solutions, finding a problem and finding it, looking for its solution. And so I have found it such a great privilege to talk to scientists over the years and give people a sense that there are ways to solve these big problems, which we don't get a lot of in the broad media. So, and through all this, what I've realized is that whether it's climate change or the issues you're discussing on environmental justice, there are apps, there are tools on the shelf, solutions on the shelf. It's a matter of simply having the political will of, moving the laws, nudging the laws in a little direction to provide incentives where they're needed, and carrot and stick approach where it's appropriate. And already we have a new administration that is putting science at the center of its policy. Imagine that. That's how we used to do things in this country. We had a 4-year interlude where that didn't happen. Now that it's back in vogue to actually listen to the experts, imagine that. We have this opportunity to take advantage of that and turn that into policy. And you, in your role in reaching lawmakers as well as the general public, can help move that discussion.
Well, that's the hope. I have said in earlier recordings in this program, in this workshop, that journalists have taken a hard hit from the public, and they've really gotten beaten up.
We are not your enemy, people. We are not.
No. You have raised the flag for many, many, many critical issues. I know personally have, not all journalists, but you have, and many others have. And I am so grateful for your bravery in speaking up and standing up and making the world better for everyone. And sometimes stories are not easy to tell. But when you can provide solutions and focus and next steps like you've done time after time, there's a reason they give you those awards, those awards. There's a reason, because you're great at your job, and you're a great teacher, and you're great at providing and conveying important messages. Many journalists are. And I think we need to, as a country, really honor and respect journalists and apologize for the behavior of these last chunk of years. Because I will say that there are media companies that have positioned wars for the sake of advertising profit, but that's not the journalist. And sometimes that happens, but we need to uphold journalists in a different way. And we're so grateful for your work.
Well, it's been a tough time, and listen, you got to call it like it is. The journalism profession writ large, and big corporate media has not acquitted itself well.
Right.
A lot of as I always say, it's fascinating to me to watch something like a pandemic, this epic story which we're living in, this ultimately scientifically driven story, being reported on by political reporters in the White House. It doesn't make any sense. If every, a political reporter sees every story through the prism of politics, and that's why a lot of the coverage, I think, has been deficient. And so this is a reflection of corporate media, profit-driven media, on its dive to the bottom for ratings, going after the salacious tweets and all those kinds of things. So this is my opportunity to talk about how lucky I am to work at PBS, which is not driven in the same way by profit or ratings. And they give me the latitude to go out and tackle complicated stories and tell them in a nuanced way with the time that's required, and also tell people, here are some possible solutions to these issues. And what a privilege that is. But unfortunately, it isn't as common as it should be. Certainly not as many outlets as there used to be when I started in the early 80s, when we had things like the Fairness Doctrine. But it's really important that people try to support good journalism where they can find it. It's hard to find. A lot of it has become partisan, and we've seen what's happened to the big cable enterprises. But it's out there, and it needs help. What we do is not inexpensive. We're not in it for the money. There's no question about that. We want to just get the truth out there as best we can.
Right. I think, Mazza, just why we have this opportunity, because we have lots of young followers, if you were to advise a journalist, an up-and-coming person, young man or woman that wanted to be a truth teller, point to the science, point to the authenticity. Where do they go? What do they do? How do they make it all work today when we seemingly see a lot of opinionaires out there in the world and a lot of drama? How do journalists make this work?
Yeah, it's tough. I mean, there are a few left, but it's all of it has drifted into the partisan realm, and it's tough. But I'm going to toot the PBS horn, but I will tell you this. Generally speaking, this is one of my theorems of life in journalism. Big corporate profit-driven companies, generally speaking, don't do great journalism. Mm-hmm. That's just generally how it goes, because, if you think about what really good journalism is doing, it's going after the big moneyed interests that run this country in some fashion. And those are the same people sitting on the board of those big media companies. And so what I look for places like ProPublica, PBS, places maybe, a little more boutique level journalism, perhaps would be one way to describe it. Operations like Vox do a very good job explaining complicated things. They're out there. But I do think you have to have your expectations in the right place when you enter into journalism these days, and think about, do you really have the fire in your belly, and are you in it for the right reasons? Because it's more of a calling than it is a killing, right? And people like your son, who I'm so proud of, who has, chosen this path for all the right reasons. He came to me, and I hope you don't mind if I talk about your son, because I'm so proud of him. He's my godson, so I love him. But he came to me interested in social justice issues and political, the political realm, and I had him think about how he wants to make a difference in the world. Mm-hmm. And I said, journalism is another way to do this. You might want to try it. You might like it. And I don't think he had really thought about it that much. And he's taken to it like a duck to water. And I'm so proud of him for doing it. And he's doing it in the right place for the right reasons. Mm-hmm. And so I ask all the young people out there, number one, if you ever have any questions, I'm always out here. But the other thing is to make sure you learn how to study the world. Liberal arts actually is a good thing. Learn how to think and read and write, and enter the profession, not with the goal of, I used to say these kids came in, they learned trench coat 101 and trench coat 201 in school and knew how to do a stand up, but they didn't understand anything about what they were talking about. They look good on camera, right? Stay focused on what journalism is supposed to be, which is to be an honest broker of the facts and try to get to the truth, which is so elusive.
It is, isn't it? It is. These are hard times for lots of people, hard to figure, I know lots of people that don't think like me, that have a hard time navigating truth and fiction. They're confused by the information that's out there, and they don't trust it. And because they don't trust it, they make poor decisions, or they make decisions that don't benefit maybe anybody but themselves, because it's the reasoning for ease and convenience. And so it's a low bar to reach for. There's lots of reasons, but, I admire journalism. I admire all the journalists out there that have really, helped advance, lots of causes that improve the world. And I'm certainly grateful for all your work. You've done amazing things, Miles. We're proud to have you on the board of Less Cancer. You've been instrumental in developing the National Cancer Prevention Workshop. And you've been a great advocate for others, which is what this is all about. And I do want to make clear that, the success of this, I'm simply just a pain in the ass. I remember Steve Israel said, "Does anyone here know Bill Couzens, or the congressman from New York?" And everybody in the room goes, "Oh, yeah, oof." He goes, "I know, that guy doesn't even take yes for an answer." So
that is a victory, pal. That's a victory.
Right, the squeaky wheel. So it is. I don't know what got me on that trail, but our change has been about collaboration and about lots of people, not just me. And I want to make that clear, that our successes would not happen if we weren't collaborating with many universities, scientists, physicians, the National Cancer Institute. None of these things would be happening without them. And there's a lot of power in collaboration. There's a lot of power in unifying messages around a cause, where we look at causes and not flavors of people. And we get all the great minds around a cause or something like cancer. And so the power and the change that we've made has been purely through collaboration and lots of people. And that's what will continue our work, is other people, not me and or either of us, you know. And it's the practice of collaborating, building bridges, not dividing. As I said in the beginning, there is no divide when it comes to cancer. It's about all of us, you know, as humans. So this is something we can tackle. It's something we're going to continue to work on, but it only happens with leadership like yours. And I'm super grateful for you joining us today.
Well, first of all, I'm thrilled to be here with you always, but I'm so impressed with the group of people that you brought together for the workshop. It's an extraordinary group of experts. You're tapping into a lot of smart people from a lot of fields that, as you say, if you can kind of herd the cats and corral that collective brain power, that hive of people who are out there to prevent cancer, if you can keep them marching in a direction, we're going to have victory here. So, you know, keep showing up. And keep bringing in all these smart minds together and bringing them together. And that's when the magic happens.
Yeah. Well, thanks to you. And thanks to so many.
No, thanks to you. Take a compliment, will you, pal? Thanks to you. All right. Thank you for all you do. I love you, pal.
You too. Thanks so much.